Hi, I'm Dr. Athre. One of the most common questions that patients come to me and ask about is facial rejuvenation. There are key things that they ask about is the fact that they say, I look in the mirror and all I want to do is look a little bit younger. I have this feeling inside of me, I feel energetic, I'm doing all the stuff that I used to do, but when I look in the mirror, that image and what I feel on the inside just don't sync. And they ask to have those two feelings kind of sync a little bit more. One of the most common things that we need to understand is how facial aging actually occurs. So there's a couple of different things that I'd like to go into in this anatomy of facial aging talk. First and foremost, we take a look at our skin. Okay? Our skin takes the brunt of all of the damage with wind and sun, as well as genetic factors and certain personal factors like smoking and nutrition. All of these things put together to get a full image of how our skin ages. Now there are things that we can do to reverse that aging, such as lasers and peels and things like that. The other thing that women very frequently come in and ask is, Dr. Athre, can't you just do a little bit of this? Well, let me kind of first go into what's actually happening, and in the subsequent videos we'll tell you what some of the options are for that. Well, why do we get a little bit of falling of the skin and tissues? Well, what's actually happening is that underneath our skin we've got muscles and tissue layers. Now those muscles and tissue layers are working very hard not only to give us our facial expressions like smiling and frowning and all of the daily expressions that we have, but they also are withstanding the forces of gravity. And over time what's happening is those tendons and those muscles get lengthened a little bit. Imagine if you had a rubber band and you took that rubber band and you kind of pulled it back and forth all day long. At the end of the day, that rubber band's just a little bit longer. That's exactly what's happening in these areas. The neck region is a little bit more special. The neck region actually in young people has a muscle layer that kind of goes in this region called a platysma. That platysma acts kind of like a corset in order to keep all the tissues tight and taut. Over time, that muscle also can have a little bit of laxity and can actually spread in the middle. All of these factors contribute into developing the facial aging profile. So this is a little bit of anatomy on what actually happens, and in subsequent videos we'll go over what some of the surgical and non-surgical options are.